Good morning, everyone. Thank you all for being here today. I'm joined by Pat Allen, Director of the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. And my mask is stuck. Get it? I think it's caught. There we go. Today, we're going to provide an update on the latest analysis of how COVID-19 is spreading in Oregon and discuss an important choice we have to make as a state. 7 months ago today, on January 21st, I established the incident management team to prepare for the possibility of the coronavirus coming to Oregon. This began a coordinated strategy between state and local leaders. 5 weeks later, we had our first case of COVID-19. Since then, unfortunately, more than 24,000 Oregonians have been infected with the virus, and over 400 Oregonians have died. Across our country, more than 5 million Americans have been infected, and over 170,000 people have died. When I issued Oregon's Stay Home, Save Lives order, some folks said it was too rash. Others said it was too late. When I decided to close restaurants and entertainment venues, but keep manufacturing and construction open, some said this action was too much. Others said it was too little. When we began reopening businesses, taking a county-by-county approach, some said it was too cautious, while others thought it was too risky. And today, close to 6 months after our first case, some say my orders are too restrictive, that the virus isn't dangerous, or even that it's a hoax. And then, of course, others say I haven't done enough, that we should shut down the entire economy immediately and start from scratch, regardless of the cost to people's livelihoods. The truth is, those commenting on the far ends of this debate, well, they are missing the point. This has always been a balancing act, a tightrope that stretches and weaves between the two extremes, where for each step I follow the data, where I listen to experts, where I take action carefully and gingerly, not knowing whether the balance will hold. Today, Oregon has one of the lowest COVID-19 mortality rates in the entire country. I want to say thank you to every Oregonian, every business, every local elected official who has helped put us in this position. We have truly slowed the spread of the virus. Wearing masks, limiting social gatherings, enforcing health and safety rules, these strategies work. Unfortunately, it's still not enough. Our infection rate is still too high to get all of our kids safely back into the classrooms and most of our schools this fall. To keep students, teachers, and staff safe in our schools across the state, we need to see a much more rapid decline in case numbers, and we need to see it quickly. There are basically two ways to do this. One option, local community leaders, county officials, and businesses, and all Oregonians can step up their efforts to implement and enforce our existing guidelines: face coverings, physical distancing, sanitation, contact tracing, and compliance with isolation and quarantine. The other option, we can implement further business restrictions and travel restrictions for people entering Oregon or returning from trips outside the state. I believe, and the data indicates, that either one of these strategies will work. Either one will drive down the spread of the virus more quickly. Either one gives us a fighting chance to open up in-person instruction and K through education in much of the state later this fall. But one path has a far greater cost than the other. Closing businesses across the state, like we did with the Stay Home, Save Lives order, works to control the virus. but the economic cost is extraordinary. Behind every business closure are real people who have lost jobs and lost income, families pushed to the brink. Each of these economic costs carries a public health consequence as well. It may come in the form of skipped meals, late bills, added stress, and increased tension at home. And all too often, it may include self-harm, domestic violence, or suicide. Economic costs have real health consequences. That's why I have been so reluctant to order further business shutdowns. We can wrestle this virus to the ground and set an example for the nation. I know that local leaders, businesses, and workers can step up and get the job done. Earlier this week, I challenged local elected officials and business leaders to step up their game. I asked our business leaders to take additional steps to ensure employee and customer safety, to reach 100% implementation of our health and safety protocols, making sure people are wearing masks and staying 6 feet apart. Local officials need to conduct more business inspections in places like indoor entertainment venues and restaurant kitchens. Community leaders need to make sure that as new cases are identified, we are connecting people with economic supports to help them stay home and quarantine, even when they have mild symptoms. We do have resources available so that people can afford to stay home. We need to get that money and help out in the communities where it's needed. Local officials need to get creative about enforcing rules against large social gatherings, big house parties, pool parties, and so forth. Too many cases over this summer have come from these informal social get-togethers. I'm here to deliver a message to local elected officials, local community leaders, and business leaders, and to every single Oregonian. Now is the time to step up even further. Many of you have stepped up and are doing incredible work complying with the guidelines and keeping people safe. Right now, I'm faced with a difficult choice. We have stabilized at roughly 300 cases per day in Oregon. We need to get down to roughly 60 cases per day. And opening classrooms for in-class learning, including childcare and K through 12, is my priority. If we cannot improve our trajectory over the rest of the month by increased compliance with already existing policies and guidelines, unfortunately, I will need to add more restrictions. When it comes to controlling the virus, we have the tools. We need you, we need everyone to use them. Before I wrap up, I want to share a few other brief updates. First, Lincoln County had held back from applying to move to Phase 2 for some time while they addressed an early and large workplace and community outbreak. Their numbers are much improved, and we have notified them that they are likely to be in a position to move to Phase 2 by Labor Day if current trends hold. Second, 3 weeks ago, we moved Morrow County back to Phase 1 and moved Umatilla County back to baseline stay-at-home status. After a solid decline in case counts, today Umatilla County will move to Phase 1. Morrow County, Malheur County will remain in Phase 1 as well. Finally, yesterday, we announced that we're taking Marion County and Wasco County off the county watch list now that they have addressed the high rates of unexplained community spread in their communities. Local public health officials and their state counterparts worked hard to get this under control. They were successful. Unfortunately, we've now added Jackson County to the county watch list because they have seen an increase in unexplained community spread of the virus. State officials will work with local public health leaders to help the community get this under control. I know how much each and every Oregonian has sacrificed over the past 6 months to protect your families, your neighbors, your communities. Many of you struggled to pay your rent or had to lay off your employees. Many of you couldn't visit loved ones or give Grandma that extra bear hug she deserves so much. Many of you put in extra shifts to serve your communities as frontline workers. Many of you might miss the fall sports season or missed summer sports. And many parents across the state have been balancing work and childcare. Thank you. Thank you. Thank you. We all want in-person education to reopen. To do that, we must meet our goals. Right now, on the course we're on, it's going to take too long. We're doing well, but we have to do better. We have to work together, and we have to do it now. Thank you. Now I'm going to turn it over to the Oregon Health Authority Director, Pat Allen.
Thank you, Governor. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I'd like to provide a brief overview of where we are in the pandemic and our response to it before I turn things over to Dr. Dean Seidlinger, who will update you on our latest modeling, our current estimated infection rate, and where we need to be able to open schools. Here are the latest numbers. Excuse me. To date, we've recorded 24,421 confirmed and presumed cases of COVID-19, including 259 today. Sadly, we've crossed the threshold of over 400,000 deaths this week, including 2 today, bringing us to a statewide total of 414. These are over 400 people who have left behind families, friends, colleagues, and neighbors who will miss them, and we extend our deepest sympathies. New cases are starting to slowly decline. That's a hopeful sign that Oregonians' efforts to wear face coverings in public places, keep physically distant, and limit social gatherings are slowing the spread of COVID-19. For the second consecutive week, daily cases have declined. For the week of Monday, August 10th through August 16th, OHA reported 1,963 cases. That's a 7% drop in new infections from the previous week. There were fewer deaths reported than the previous week as well, dropping from 39 to 31. The percentage of positive tests has leveled off. Last week, we reported 25,678 test results, and the rate of positive tests stayed the same at 5.4%. Please note that that's a data point that will change over time, as we're now counting tests by the date the specimen was collected, meaning that those numbers will change a little bit as more test results are reported to us. Hospitalizations offer another encouraging sign. New COVID-19 hospitalizations also declined last week from 143 to 115. The downward week-to-week trend in COVID-19 cases is in line with our modeling, which was updated today. Dr. Seidlinger will speak more about that shortly. We're making a difference in stemming the tide of COVID-19 in our communities, but the virus remains prevalent across the state of Oregon, and it's a risk to everyone. We're on the right track. Now we need to step on the gas. I want to share one more encouraging development on COVID-19 testing. This week, we secured an agreement between the Oregon State Public Health Laboratory and Thermo Fisher that will provide testing supplies to add over 20,000 tests to our weekly capacity on average through December, or about 400,000 tests in all. The tests will be distributed to certain qualifying laboratories, increasing Oregon's overall COVID-19 testing capacity. The new agreement builds on one that the state lab had in place with Thermo Fisher and the U.S. Department of Health and Human Services in May and June, under which the state lab received and distributed supplies for some 130,000 tests. The State Public Health Lab will continue to distribute test kits to its current partner laboratories and will reach out to additional qualified labs to further expand testing capacity in Oregon. Adequate testing is important to slowing the spread of COVID-19. If we cannot test people and get the results back quickly, we lose our ability to take steps to keep the virus at bay. This agreement will help speed up results and ensure we have more capacity to test as needed. With that, let me turn things over to Dr. Dean Seidlinger, our State Health Officer, to discuss the latest modeling data.
Thank you, Director Allen. I'm Dean Seidlinger, the state epidemiologist here in Oregon. You've heard an overview about the present state of the virus in Oregon, and I want to update you on what we can expect over the coming weeks. Our latest report shows that the transmission of COVID-19 is slowing and that we're seeing this declining transmission, which started at the beginning of July. The new report, again, models 3 scenarios, and all 3 suggest that the actions we're taking are working to flatten the curve. If our transmission continues at its current rate, our estimated number of weekly infections will remain steady at approximately 900 over the next 4 weeks. Severe infections, meaning people that need to be hospitalized, would remain stable at about 19 per day. That represents a transmission rate of 1, meaning for every person who's sick, they infect 1 other person. If we can get this transmission down by 10% over the next 4 weeks, we can expect the number of COVID-19 infections to drop. Compared to the previous scenario, we would see 600 fewer infections each day and 8 fewer severe cases. That gets our transmission rate down to 0.75, meaning each person who's sick infects less than 1 other person. But if transmission increases in the next 4 weeks, we would see 1,300 new infections daily, an uptick in severe cases to almost 30, and that transmission rate of 1.25 represents a significant step back. And I don't think we're going in that direction, but we all have a role to prevent that from happening. So while our COVID-19 data shows that we're doing better than many other states, the virus continues to be a significant threat in our communities, and we're not close to keeping the infection rate at a level we need to reopen schools across Oregon. We've made progress. The model shows that our collective actions have reduced transmission rates since the increases we saw after we reopened. And we see that confirmed by the leveling off of numbers that Director Allen presented to you. Oregonians have flattened the curve again. But as the charts behind us show, we're still months away from driving infection rates down to a level which we could safely reopen schools. We need to cut our transmission down from 1 to 0.75. Currently, we estimate that every person who contracts COVID-19 is passing it on to 1 other person, and we need that to decrease. To safely reopen schools, we need to make sure that people who become infected are passing it along to fewer numbers of people so the virus is not spreading at a sustainable rate. I want to tell you a couple of stories about what we're seeing in the data here in Oregon. When we talk about workplace outbreaks or outbreaks in a skilled nursing facility, most people probably understand what that means. But when we talk about social spread, people may have a harder idea. So I want to share a couple of things that our epidemiologists and our local public health authorities are seeing. We had a young adult who attended a family gathering. Later on, a family member at that gathering tested positive. But unbeknownst to that person, they went to a wedding, and they participated in that wedding and developed symptoms and tested positive after the wedding. Another member of the wedding party, as well as the bride, became sick, with other Oregon guests testing positive, and reports of multiple guests who'd come in from out of state being sick as well. One of those guests then had contact with about 30 people while they were potentially infectious, most of those being people that person worked with. And subsequently, we've seen 10 cases in the workplace. So that's how attendance at a family gathering, something we all yearn to do, where we often let our guard down because these are family members that we haven't seen in a while, can lead to multiple cases in multiple gatherings, in workplaces, and across state lines. We also saw a large family coming from 9 different households who wanted to get together for a vacation and spend some time together. What we've seen is 15 people from that gathering have gotten sick, ranging in age from young kids to grandparents who are at most risk for severe consequences from this disease. Again, we all yearn to get together with our families, but we need to do so in a safe manner in smaller groups and use technology, to keep in touch while we ask you not to get together in these larger groups right now. So how do we do that? how do we keep the pressure on COVID-19? First, we ask you to stay apart from people outside your household and limit the size of those gatherings. When you're outside, keep your physical distance and wear a face covering. We know that many people are following these guidelines, but not everyone. So we need all Oregonians to maintain safe, healthy actions to fight COVID-19, to drive our infection rates down so that we can reopen schools and get closer to the return of normal life in Oregon again. These are actions I'm not asking you to take today or this weekend or next week, but over time. We're in this for the long run, and we need to take these actions and keep up the pressure. Thank you.
I think we're ready for questions, Charles. Thank you, Dr. Seidlinger.
Thanks everyone for joining us today. Just a quick reminder, please press 0 to get into the queue to ask a question and work with the operator. We're going to start with Dan Tilkin from Coin. Go ahead, Dan.
Governor, thank you. You talked about the possibility of further restrictions. What would those further restrictions be? And somebody told me that you told a group of county leaders that would be 270 days before kids would be back in school. Is that true?
Thank you for the question. In terms of your first question, I think the additional restrictions that are on the table are closing certain businesses. One that comes to mind, obviously, are bars and restaurants. A number of states have taken that direction or moved those services entirely outside. The other thing that might be on the table is travel restrictions, requiring people to quarantine if they come, for example, from a hotspot state, or if Oregonians travel to visit their aunt or family in another state, having to quarantine once they come back. So those are the types of things that are on the table. Again, it is my hope that we don't have to issue further restrictions. We know, based on the data, that if Oregonians continue to adhere with the social distancing guidelines and the face covering guidelines, that we can get where we need to be. The timeline, and I don't know if you can see the chart, but essentially at the current disease replication rate that we have, it will take roughly over 200 days before all of our kids can get back into the classroom. As we said, this isn't good enough. It's not good enough for Oregon, and it's certainly not good enough for our school kids. So if we can get the R0 factor down to 0.75, the R0 factor being the replication factor, it can happen in as little as 6 weeks. So it's honestly all up to all of us, and it's going to take collective effort and collective action. I've asked community leaders, business leaders, and business owners to step up. I've asked elected officials to step up compliance efforts. We can get this done.
Thanks, Dan. We'll go next to Lachey Wesley with K2 News. Go ahead, Lachey.
Hi, so Governor Brown, what exactly would you like to see from counties? Can you please be specific? Exactly what are you asking from them? And are you considering a new temporary stay-at-home order for the Labor Day weekend?
To answer your first question, at this time, I am not considering a new stay-at-home order for the Labor Day weekend. In terms of what are we asking local elected officials to do, I would say 3 things. Number 1, lead by example. Number 2, educate first. And number 3, enforce when necessary. So, for example, we've heard from communities that local law enforcement are choosing not to wear their face coverings, not to wear their masks. This is absolutely unacceptable, and I expect our law enforcement to follow the law. They need to do their jobs. We know that some community leaders, county leaders, elected leaders have pushed back and said they're not going to adhere to these guidelines. Again, we ask everybody to follow these safety guidelines to ensure the health and safety of all Oregonians. And when I say educate first, we want to make sure that local law enforcement has the ability to enforce, for example, either the social gathering requirements and the face covering requirements, we would ask them to educate first before they move to other means. And as I said, enforcement when necessary. Failure to comply to wearing a face covering is subject to a $500 fine. And honestly, not enforcing these requirements puts the entire community at risk. I have to tell you, I just received a phone call from a county commissioner this morning. She had a great idea about training volunteer employees to go into businesses and ensure that they're adhering and complying with social distancing and face covering requirements. It's a great idea. The reason why I had conversations with our local elected officials and business community first is because Oregonians are really creative and innovative. We can innovate our way through this problem, and all of us working together can do much better than each one of us working alone.
Thanks, Lachey. Next up, we have Ted Sickinger from the Oregonian. Go ahead, Ted. Ted, are you there?
Yeah, hi. I am. Can you hear me?
Yeah,
Yep.
go ahead.
Okay, great. Governor, I'm wondering, are you sending a bit of a mixed message here in that you're sort of issuing this clarion call for, people to really step up with all the social distancing regime, et cetera, and yet you're using restrictions on a number of counties that still have, fairly high infection rates, positivity rates that are very high, and you're talking about the prospect of Lincoln County has just had a workplace outbreak, and I think you mentioned Malheur at one point, and they're kind of in pretty bad shape. And I'm wondering, what kind of message does that send if you then say you want to turn around and really tighten the screws if infection rates don't come down?
Well, I think I'm asking Oregonians, all of us, to work collectively. This is a culture change, Ted, and it takes time. And I'm asking local community leaders, I'm asking local elected officials, and I'm asking the business community all to step up and take collective action to ensure better compliance more quickly with the social distancing and safety protocols we've put in place. You're asking about mixed messages. Yes, are there some counties still in phase one? Absolutely, based on the virus infection rates in those particular communities. Moved Malheur last week to phase one, and this week we're moving Umatilla County up from baseline to phase one. Again, there are still a number of restrictions in place, including for informal social gatherings. We have substantially enhanced safety protocol at bars and restaurants. We have enhanced and refined our face covering policies, both out in public and in office spaces. We are trying to send a very clear message to Oregonians. If we don't step up to the next level, then I'm going to have to take more restrictive action. And that is a decision I am reluctant to make. And it's a decision that by all of us working together, we can prevent.
Yeah, some of the counties are saying that they don't really have the resources they need to step up any further. They're kind of hamstrung. And I do think that testing agreement is interesting. It will certainly help out. But is the state in a position to really step up its aid to counties?
I'm going to let Director Allen respond to that, but I just got off the phone with one of the local public health directors from one of our remote rural Oregon counties. I have said to them that, certainly we are willing to step up our efforts. I think the part of this is connecting the dots for folks. When someone tests positive or is waiting for a test and they're experiencing mild symptoms and they want to go to work, and I understand that, and they have to figure out how they're going to pay their rent or put groceries, food on the table. we want to make sure that there is a connection in terms of the relief dollars that are available for folks who are in this situation. So I would, the point of my conversations is to make sure that communities in partnership with the state are developing wraparound services to support these families, these workers that need to quarantine and need to isolate. Director Allen.
Thank you, Governor. Yes, we have the ability to provide additional resources, help, advice, those kinds of things. We're able to prioritize long-term care facilities for more urgent testing in communities that have that are on the watch list, as an example. We're able to provide case investigation and contact tracing assistance in communities. I think one of the challenges that we have is we can't just do that stuff unilaterally. We have to be able to work in partnership with local public health, with county government, and with others to be able to make that work. And honestly, we've had circumstances where there's been a problem and a county has reacted immediately. We're already in conversations with Jackson County, having put them on the watch list yesterday, and it didn't take but a few hours to have those conversations start. We've had other counties where the watch list didn't seem to generate much interest at the local level in trying to make use of resources, and so we've kind of taken further steps to try to engage that, and ultimately it works. But those resources are available and can be deployed. As well, the counties don't need additional resources from us to do the things the governor has talked about today in terms of engaging local law enforcement to wear masks, or to set an example at political leadership in a county, use the resources they already have around enforcing the restrictions on restaurants that are there. All those kinds of things are tools that local government already has.
And the only other thing that I would add is that one of the lessons for me, and I look forward to having a lessons learned when this pandemic draws to conclusion and Oregonians have tackled it, is that we have underinvested in public health across the country, at the state level and the local level. The local county public health director that I spoke to, she just said, we have 3 people tackling this pandemic, 3 FTE. We have not invested. We have taken the importance and the critical role that public health plays in protecting the health and safety of all of us for granted for a number of decades now. And I think that is a really important lesson learned for the future, that we have to keep both our local public health, our state public health, and frankly, our federal public health systems extremely robust and strong if we want to ensure the safety of our citizens.
Thanks, Ted. Next up, we've got Brenna Kelly from KPTV. Go ahead, Brenna.
Yes, good morning, Governor Brown. You said if case counts do not decline enough by the end of the month, you'd have to implement more restrictions. Are you putting a hard deadline on August 31st? Should people expect, if there isn't enough compliance, that September 1st you'll announce more restrictions?
Thanks. I'm going to turn that over to Dr. Dean Seidlinger.
Thank you, Governor Brown. I think, it's hard to put a hard line on that. What we've seen is really over the last month to month and a half, a plateauing of our case, and now a fairly steady, slow decline. Our modeling indicates that will continue, and I think if we're seeing that kind of progress in our conversations with Governor Brown, we'll continue to have these conversations to ensure that Oregonians are still complying with our recommendations, limiting their gatherings, keeping their distance, and covering their faces. To put a hard and fast line to just move everyone back, I think would do a disservice. The progress we're making is slow. We know we can continue, and with additional people wearing their mask and following our guidance, we know we can get the numbers down even quicker. That number of getting more Oregonian students back into school safely, those students and staff returning safely to school, is within our reach. It's 6 weeks away if we all continue to do our job, and getting those students back into school is a great relief, not just for those students, those staff who can return to school safely, but those parents who can also stop, being classroom teacher and working full-time from home, with all the distractions that entails. So I think, we have some work to do, but it's attainable, and I think if we continue to see the progress we're seeing, the governor, will be able to continue this current course.
Yeah, hi. So, Marion County, you got removed from the watch list yesterday. The White House, there was a state report that came out, it was earlier this week, that they still had Marion County and Salem in basically their watch list. Was there something that changed there, or was there something that you guys are seeing now that's different than what the White House was saying earlier this week?
I can't answer the specifics of that question, but I do know that some of the information that the White House is using is not always up to date or accurate. Can either one of you add?
Yeah, thank you, Governor Brown. This is Dean Sondlinger. Sometimes our data from the federal government lags a little bit as they compile data from across the 50 states and territories. What we've been heartened to see from Marion County is that their initial cases that rose above 50 sporadic cases per 100,000 in those previous 2 weeks, they were able to investigate those cases, get that data into the system, and show that those cases were connected to other cases. That work, that strong public health investigation, continued over the next few weeks, and their rate of new sporadic cases has continued to remain below 50. So with that data in hand, we talked to the governor, and that's why we're removing them from the watch list. But Marion County, like every other county, we continue to watch this data on a regular basis, update it weekly. For trends that are concerning or counties that go over that limit, we reach out to see what we can do to help them. And then if they're placed on the watch list, to have a more formal agreement about identifying the resources they need, prioritizing those resources, and working together to stem the spread with our public health tools in hand.
Thanks, Bill. Next up, we have Dirk Vanderhart with OPU. Go ahead, Dirk.
Yeah, thanks. Good morning, Governor. A little bit off topic, but still about the response here. You're the only governor that didn't impose a moratorium on disconnections of utilities on the West Coast, at least. And, there has been a voluntary moratorium that is now ending for some segment of utilities. I've been trying to figure out exactly what you saw that Governors Inslee and Newsom didn't see when you decided not to issue a moratorium and restrict people having their utilities disconnected at this very hard time. Can you offer some insight?
Yes. No one should go without electricity during this crisis. And we have been working with utilities to ensure that there are no cutoff notices. We've been working collaboratively is how I would describe it. In addition to the CARES Act, I worked with legislative leadership to secure $15 million for low-income home energy assistance program. If Oregonians need assistance, they should call 211 or visit 211info.org.
But, as you know, some of the consumer-owned utilities are resuming disconnection practices. I don't know, and I don't think anyone knows how many people have been disconnected, but that is beginning. Does that concern you?
Yes, absolutely, and that's why we're working with them to avoid that and working collaboratively and collectively to make sure that doesn't happen, because no one should go without electricity during this crisis.
Thanks, Dirk. Next up, we have Rachel Monahan with Willamette Week. Go ahead, Rachel.
Hi, Governor. I'm wondering what role the OEA has played in your work on deciding when to open schools. Even in states where the case count is low, there has been pushback in the case of strong teachers unions to going back to school. Looking at New York City, the teachers union is now pushing back, even though they have very low case count and a positivity rate below 3% or 2%, something like that. So I'm wondering, what kind of guarantees you've gotten from the union that teachers will be willing to go back to school if the metrics are achieved.
So my top priority is to get our...
Sorry, Rachel, we're getting a little feedback on your line.
Yeah. My top priority is to make sure that all of our kids, regardless of who they are or where they live, have access to a high-quality education, and that our students, our teachers, and our professional staff are safe. and obviously very committed to getting students in the classroom as quickly as possible. I know it's really, really challenging for a lot of kids to learn online. In terms of my conversations with the Oregon Education Association, I have had multiple conversations with the OEA, and I am continuing those conversations through my Healthy Schools Reopening Council. We have a number of teachers, of educators on that council, and they are participating fully in that conversation. The metrics we used are based on science and data. We are using data from, frankly, all across the world. We want to be able to do this safely when we reopen, and we want to make sure that we're not ping-ponging. In terms of particular agreements, educators, teachers, professional staff should all know that I want to make sure that they stay safe, and we've set the metrics at a level where I believe that can happen. Dr. Seidlinger, do you want to add anything else?
No, Governor Brown, I think that's all correct. I think the safety of the students and staff in schools has been at the forefront of our discussions with the Oregon Department of Education and partners across public health and education. We set some basic metrics across the state that we would want to meet county by county to reopen schools safely, and then looked at some of those students who would most benefit from returning to in-person instruction and how we could do that safely, whether it's prioritizing kindergarten through third grade students from coming back, or working very closely with our rural and remote communities who aren't seeing significant spread of COVID-19 or any spread of COVID-19 in the communities, of how could we bring those students and those staff safely back to school, even if a county that may have an outbreak 80 miles away with no connection has cases. So I think we set up some very strong metrics for public health about when it's safe to return students and staff back to school, and the Ready Schools Safe Learners Guidance sets us some very strong guidance about what schools have to do to protect the health of the staff and the students who return, and those blueprints have been filed with the Oregon Department of Education, shared with local public health, and that's what we will work together to keep everyone safe in schools.
Thanks, Rachel.
I've got.
Go ahead.
I understand that the criteria you're using is one that's used elsewhere. It's not an unusual criteria, and that you view it as safe. I'm wondering what guarantee you have that teachers will actually walk into buildings if you achieve that.
I think Governor Brown mentioned that she's had.
Is there anything at this, is there feedback, have you gotten feedback from the teachers union that they are feeling confident that their members are willing to teach if you achieve those numbers?
I think, as Governor Brown mentioned, she's had conversations with the Oregon Education Association. Oregon Department of Education has also had conversations, and we've included teachers and their voice as part of our reopening meetings. We know that we're hearing from both sides, from teachers who are very anxious to get back to school and get in front of their students and teach them as the case rates go down. We've heard from other teachers who are anxious and nervous about going back to school. They may have a pre-existing condition or someone at home. And so we're working to make sure that we share our metrics, that we share the steps that we have in place to ensure that students and staff can safely return to school. We also have a process in place working across schools and local public health in case a case is identified. Because as students and staff return to school, we know we're going to see cases that may be associated with schools. So how do we respond quickly to ensure that we don't see spread in the schools and providing the maximum safety for those individuals who return? So while I can't guarantee what the Oregon Education Association will do, we are engaging and continue to engage with teachers and unions across the state to ensure that everyone who returns to school can do so safely, and so we can provide a healthy environment for those students and those staff.
We have time for just a few more questions. We're going to go next to Paul Schakowsky with Bloomberg News. Go ahead, Paul.
Yes, for Dr. Seidlinger, can you please describe any outbreak activity at farm labor housing and whether it might be contributing to community spread? And for the governor, do you think the Oregon OSHA temporary administrative role addressing farm labor housing is adequate to the task of containing transmission?
Yeah, thank you for that question. We have seen outbreaks amongst our migrant and seasonal farm workers. We can't say for sure if that spread occurred in housing or at work or outside of the workplace, but we have seen some spread there and have worked very hard with our local county public health partners, community-based organizations, and federally qualified health centers to get testing into those communities to provide support for those workers who may be missing work because they've tested positive, or those individuals who are exposed and need to quarantine at home. That's been an effort that we started early on in partnership with the Oregon Department of Agriculture. There are additional resources that have been allocated specifically to address the needs of migrant and seasonal farm workers and to look at the housing and the places where these individuals live while they're in Oregon to work. So yes, we have seen some spread there, but we brought additional resources to bear, brought all partners together so that we can respond to any outbreaks we see there, because we know that those congregate living and those close working conditions can spread the disease fairly easily. And I'll turn it over to Governor Brown for the rest of your answer.
Thank you. The short answer to your question about Oregon OSHA is yes, I believe they're strong enough. The caveat being is obviously there's no guidebook, no playbook for this pandemic, and we're working hard to make decisions, place regulations in place to ensure the safety of workers and obviously business owners as well. And always room for improvement after we see the impact of a particular regulation. But I have to say, this is really, as Dr. Seidlinger said, really about collaborative efforts and partnerships. We've been meeting with the Farm Bureau and the farm worker organizations and the Department of Ag for months now to make sure that businesses, producers understand the safety protocols, that we can get resources out on the ground to help our producers, and that we are in strong partnership with the community-based organizations to assist with education and informational efforts for our workers. Our agriculture sector is critically important for Oregon. It's critically important economically, but it's also critically important culturally. And I think it's key that we invest dollars, resources on the ground to ensure the viability of this important sector and the safety of the people that work in it. Oregon's really proud that I will just say we were one of the initiators of the farm to table movement, and we are really proud of that heritage. We want to make sure that we protect the folks working in that system and that we continue this really important heritage for future generations.
Governor, could I just
Sure,
add a little bit?
sure.
The legislature just recently authorized $45 million of funding to be able to be used by community-based organizations, specifically targeting at-risk populations and communities. We right now have a very fast grant process out to be able to distribute those dollars as quickly as we possibly can to enable those community-based organizations to do exactly the work that the governor's talking about.
And then we even created, and I don't know if this is unique to other states, we created a quarantine fund. My team started working this spring, working with a number of the stakeholders so that there are resources available for workers that need to stay home because they have either tested positive or they're waiting for their COVID-19 tests. I know this is an economic hardship for a lot of families. We want to make sure that we have replacement paychecks. And so we have $30 million in our worker quarantine relief fund that's available for families in need across the entire state of Oregon in this sector.
Thanks, Paul. We have time for just a couple more questions, so we'll go next to Nick Budnick with the Portland Tribune. Go ahead, Nick.
Hi, thank you for the time. Governor, it seems like your focus on getting students back into classroom instruction implicitly acknowledges what a lot of parents are telling me, which is that online instruction is just not adequate for a huge number of students, and just the inequities involved just are magnified by kind of a great degree. And yet here we are, the second straight modeling report, which shows a transmission reproduction rate of 1. So no improvement from 2 weeks ago. We continue to plead you continue to plead for people to take personal responsibility. But how realistic is it for there to be enough improvement to actually have in-person instruction this school year, especially given the testing delays that have been sort of on the increase, which just seems to mean that, according to the public health people I talked to, there's no certainty on where that reproduction rate is. It could be getting worse for all we know. How confident are you that voluntary action will get us there?
So thank you, Nick, for that multiple part question. In terms of the testing delays, there's no question that Oregon, along with many other states, are facing a challenge in terms of adequate testing supplies. My team and I have been on the phone with federal authorities and the White House in the last couple of weeks requesting additional support and supplies. Director Allen just talked about the recent agreement with Thermo Fisher. So we're working hard to continue to expand our testing capacity. In terms of this choice, I'm laying it out very, very clearly for Oregonians. We have a choice. We can continue to follow these comprehensive safety protocol and do more of it, do it faster and do it better, or we have the option of closing down businesses. And I know that that also comes with health costs as well. I think what is different this time around is that we have very clear modeling data, and I have asked local elected officials, I am asking the business community, I'm asking everyone to step up with enforcement efforts. What I heard on the call with local county commissioners is that there's definitely some COVID fatigue out there, and I hear that. We all want to get back to normal, but unfortunately, we have to continue to ramp up our efforts. And the second part of that is at the state level, making sure, as I said, we're connecting the dots around providing wraparound services to folks who are either waiting for their COVID test or have tested positive and have mild symptoms or have strong symptoms. We want to make sure that each one of these Oregonians has the support, the financial support, and the services available to them so they do what they need to protect their family members and their neighbors and their community members. I think the other piece I would say is that the data now is really, really clear. And it really is, the choice is really in the hands of Oregonians. And we know that there have been law enforcement officials, there have been elected officials that have been lackadaisical about complying with safety protocol. I'm asking, I'm encouraging, I'm incenting everyone to step up to the next level. I think we can all do this, but we're all going to have to make a collective effort here.
Could I add
Sure.
a couple of things?
Sure.
Nick, I think when we look at the model, it's important to remember that the model lags reality a little bit. The data, the most recent data is a week or more old, and it builds on even older data. As we've talked about today, the number of cases has been declining over the last couple of weeks. That's with a test positivity rate in the range of about 5%, which would indicate that that's a real decline, not a decline that's being masked by insufficient testing. I think even more important, though, as of our school metrics release on Monday, we have 14 counties that meet the metric for K through 3 education. That's up from 13 the week before, up from 11 the week before that. And so I think while that metric is considerably higher than the K-12 metric, it demonstrates that we are making progress toward being able to get as much in-person education as we can. And that's why the theme of today really has been this notion of we really need to, everyone needs to step up their efforts. Oregonians, community leaders, everyone needs to do what we're doing harder and cause that decrease that's occurring right now to steepen to get to that point.
And I do think, and maybe, I don't know if Dr. Seidlinger wants to speak to this, but we know that the tools that we have in place are working. That's the good news. As I said, we need to do more of it faster, better, more comprehensively. But we don't know specifically the impact of each tool, the percentage decrease that results in reduction in virus transmission. I think in a year or maybe 6 months, we will have that data and we can say, if we close this, then we know anecdotally, for example, that social gatherings are a contributor, a major contributor to COVID-19 spread. That's why I instituted several weeks ago a strong restriction on indoor gatherings, 10 and under. And that's why we limited outdoor social gatherings as well. So we're continuing, as always, to make decisions based on science and data. And I will continue to put the health and safety of Oregonians at the forefront of my decision-making. I also want to get our kids back in school. And I know the parents and the grandparents and the guardians out there all agree with me on that one.
Thanks, everyone. Thanks, Nick. That's all the time we have for questions today, but thanks for joining us.
Thank you.